Hi everybody, I'm Laura with Kansas City Mom Collective, and today I'm with Mom Misti Rutherford and her daughter Adlei, and she was born with a left complete cleft lip and palate, which can have many implications with feeding, speech, and growth. And Misti and Adlei are here to tell a little bit about their story. So Misti, explain the diagnosis when you found out about it.
I actually didn't find out until the day she was born. We decided that we did not want to know the gender of this one. She was going to be our last, so we forewent all sonograms after 6 weeks just so that we wouldn't know. So the day she came out, we found out that she was a girl and about her cleft.
And so what type of implications did that have as she was a newborn?
Different things. I breastfed. I was told at first that I would not be able to breastfeed her. I was able to. I maneuvered it many different ways to see which way was able to work. We figured out a way. She breastfed up until her first surgery, breastfed after that until a little after 2 years old. So she did great there. Just different things. Her left nostril was collapsed. So it was hard breathing issues, only being able to breathe out of one side. A lot of congestion because that one was always clogged up. So I mean, that was just always just worrisome right from the beginning was, oh no, after that first surgery, it just collapsed down and just started growing extra cartilage and closed it off to maybe a pin-sized hole.
Wow. So when did you start having surgeries and getting treatment?
She had her first surgery at 5 months old. We about didn't make it because you have to meet a criteria of 10 pounds. And she hit 10 pounds 2 days before her surgery.
Wow. Good job.
She was tiny.
I bet. And that's from some of the feeding issues.
Yes. She actually was still in newborn and 0-3 month clothes at a year old. She had only weighed 13 pounds at a year. And now she's
Look at you.
so tall.
How old are you now?
5.
5? And how many surgeries have you had so far?
3.
3? You're a brave girl, aren't you? Tell us how you found Dr. Christopher.
Through a friend, actually. I cheered with her in college, so we kind of stayed close. I had recently saw that her baby was born with a cleft also. Saw her in Walmart, random conversation. I told her that I was having some issues finding a new provider for Adlei to get the nose surgery done, to get it open so that she could have better breathing. And she was like, you have to meet Dr. Christopher. That's who we see. And I was like, really? Where's he at? And she explained that he's at Overland Park and gave me his contact information. I went home, I called his office right then, and they set up an appointment the next week. And we went and saw him, and within a month, surgery was scheduled, and here we are.
Isn't that such a relief on a mom's heart when you can find help for your kid?
Not only that, but with surgeons and situations where we know that we're going to be in this situation into her 20s, most likely.
Right.
We want to know that it's a family. You're part of our family now. You're going to grow up with us. She's going to see him all the time. We want that kind of feeling. And as soon as we met him, they connected, and we knew right then it was a match. We're going to stay.
That's wonderful. So we have Dr. Christopher from the Pediatric Center of Overland Park Regional here. He's going to come in and check you out. Say hi. Come on, Dr. Christopher.
Hi. How are you?
Good.
Good. Are you enjoying your little talk today?
Yeah.
Yeah? How was the drive down?
We did hit a deer this time.
Oh, yeah, that's right. For your first surgery, you hit a deer, didn't
We
you?
did. We were an hour late for surgery.
But you guys made it.
Yes.
Yeah. Good. How's your breathing?
Good.
Good. Are you still having troubles taking deep breaths at all? No?
No.
Okay. Good.
Thank you so much for joining us, Dr. Christopher.
Absolutely.
He is a part of the Cleft and craniofacial team at the Pediatric Center at Overland Park Regional. Tell us a little bit about your role here and the office.
Yeah, so I'm a cleft and craniofacial surgeon here at Overland Park Medical Center, and I co-direct our cleft and craniofacial team with Dr. Allison Kay, and where we get to treat all kinds of exciting cleft and craniofacial conditions. And we've been here since, the program has been running since July the past year, and we've been growing like crazy, and it's been amazing.
Tell us a little bit about what is next for Adlei, like how many more surgeries you envision her having.
Yeah, so Adlei so far has had about 3 surgeries, from her primary lip repair to her revision surgeries that she's had. And because of her cleft, as you can tell, her nose is really collapsed on one side where the cleft was, and deviated over to the other side. And also, I don't know if you can tell, but her upper jaw isn't actually growing to its full potential. So Adlei will need a couple more surgeries, at least 3 more. So because she had the cleft that was involved in the lip and the palate, she'll need to have this procedure called an alveolar bone graft, where I'll take a piece of bone from her hip and put it in the jaw so that her teeth actually come into bone. And that's her next surgery after this. And then after that, we let her grow for a while. And because of the restriction in growth that she's having, Adlei will most likely also need jaw surgery to help place the jaw in the right place once she's actually gotten to skeletal maturity. And then after that, we'll take a look at doing her nose surgery, her rhinoplasty, where we put the nose back to essentially where it's supposed to be.
So this is something that'll follow her as she grows.
Yeah, so I usually tell every parent when I meet them is that, we'll be seeing each other up until they're at least 18 years old. So we get to know each other.
So you do become a part
of
of
the
the family, like
Misty
Misty
said. Exactly, yeah.
So the Cleft and craniofacial care team is a new service at the Pediatric Center here. Can you tell us what other types of conditions you treat besides the cleft palate?
Yeah, so we do, outside of the cleft lip and cleft palate, we also do conditions such as craniosynostosis. Craniosynostosis is essentially when the skull fuses a little bit too early, prematurely, and it's a pathologic condition in which the brain isn't allowed to grow. So we treat those kinds of conditions. So that's craniofacial. We also treat things like hemifacial microsomia, sometimes where the actual jaw doesn't develop fully, where they're missing part of their jaw joint, maybe part of their ear. So we address those kinds of conditions. Pure or band sequence, in a condition in which the child has an issue with breathing and feeding. And so this is typically noticed right after birth, but sometimes it can be a little bit later. And typically we treat those by doing something called a distraction osteogenesis, where we essentially separate the jaw and help the jaw grow. And what that does is it pulls the tongue forward and helps the child breathe a little bit better.
Your team works with other pediatric specialists.
We do.
What other kinds of specialists will Adlei and other cleft palate patients need to see?
Yeah, so our team is a multidisciplinary team, and so within our team itself, we have other physicians that we work with, including ear, nose, and throat, ophthalmologists. We also work with developmental pediatricians, and then on top of that, we also have other services that the children born with cleft lip and palate and other craniofacial conditions need, such as speech-language pathology, nutrition, social work, and so all of that is a part of the team. And then also, like Adlei's mom just mentioned, they're also about to go see a dentist, and so we do work closely with dentists in the community as well as orthodontists. And Adlei is going to start needing a lot of that. She's at that age where she'll start kind of needing those services now.
Okay, so it's nice that it's kind of, you guys can give them access to a lot of different resources that they'll need.
Absolutely.
So if a mom who is expecting finds out that her child is going to have a cleft palate, are you seeing patients right away? How can they get a hold of you?
Yeah, we are. Catherine, our cleft coordinator, is someone who is absolutely essential to the team, and that's how you can get a hold of us. Typically, we see a lot of prenatal consults where once a mom finds out that they have a cleft, they give us a call, and we'll have them come in as a team. We'll visit with them, and that's our initial exposure. And so we tend to find out, well, what do they know about their clefts? What do they need from us? We kind of give them an education, essentially what it entails to, based on what kind of cleft that they're going to have. Because you remember, every cleft is different.
Right.
Right, and there's different severities to it. Some could be just an isolated incomplete where it's only the lip, or it could be all the way from the lip, the hard palate, all the way to the soft palate. So depending on what the diagnosis is, we'll usually be able to tell at the very least the lip on the ultrasound, and we can talk to the family about it, and then kind of go from there. So the best way to get a hold of us is to get a hold of our cleft coordinator, Catherine.
Well, thank you so much for your time today and for the ease of access and getting help for Misty and Adlei. I know as a mom, that's always super important, is being able to get in and get help and feel like that doctor is part of a care team.
Absolutely, yeah, definitely.
The Cleft and craniofacial team at HCA Midwest Health treats patients with congenital and acquired abnormalities of the head and neck. Whether the diagnosis of a cleft or craniofacial condition occurs before or after birth, their team, Dr. Christopher, is prepared to offer ongoing supportive care. You can learn more about cleft and craniofacial services at hcamidwest.com.